Morning.
Good morning.
One, two, three, four, five, 6, 7, 8, 9, 10. Good morning, everyone. First, we'd like to thank everyone who stayed home and found alternative ways to celebrate the weekend. We knew there were a range of religious celebrations this weekend. And we knew people were outside walking where the weather was supportive. People were outside walking around and doing that, I think, in a very safe way. People understand the message around social distancing. We've seen evidence of it, and that's very heartening to see that people have adopted the Ohio plan, have understood the importance of good public health prevention. And so we're glad that people did that, because that these decisions over this weekend and going forward will have a major impact on our trajectory as a state, as a community. We want people to remember that if you're going to be out in public, that you want to wear a mask. That this is a mask actually Dr. Gullett made for me at home with a couple of hair rubber bands and a piece of cloth. And so I think it matches my outfit. So if you're going to be out in the community, it matches my gray hair too, so it sort of works out, right? So if you're going to be out in public, we want you to wear a mask. Dr. Fauci from the National Institutes of Health has said that up to 50% of folks could be asymptomatic. 50% of folks may not have symptoms. And so a mask, and Dr. Acton has reinforced this, a mask is a great way to help to prevent exposures, particularly for those that you care a lot about. All of us have relatives, friends who may be particularly at risk. So the easy thing about this is these masks can be made, lots of YouTube videos on how to make masks, right? So in this particular one, we take it, and this one goes around the ears. I have big ears, so it helps to support the straps. But you have a mask. You want to make sure that it's snug, right? Make sure the mask is snug, covering your nose and your mouth, okay? We've seen some masks. This is not right. This is not right. You know, we've seen masks that are like this. This is not right. So we want to make sure that we use our masks appropriately. It has to be snug. And this is done and made very quickly. So there's a mask for you in public, and you're preventing the droplets from being disseminated. So we'd encourage you to do so in public. And Dr. Gullett has a lot funner masks she'll share with you. So the next thing we'd like to talk about is that we want people to stay home when you're sick. And I think the important message here, you've heard that before. The important message here is that you need to stay home when you're sick with a whole range of symptoms to think about. It isn't just this cough. It isn't just shortness of breath and fever. But if you're not feeling well, we want you to stay home, because the spectrum of symptoms that may be associated with potential exposure are important to think about. They could be a range of things. It could be, it may be diarrhea. It may be a runny nose. It could be muscle aches. These all could be early indications potentially of COVID-19. And so these early symptoms, by not only monitoring your temperature and shortness of breath and other related classic symptoms that we've heard about, we need to be aware of these other ones we think that are also very critical to consider. So we also know, just yesterday, the governor noted that he will be issuing an order requiring long-term care facilities to notify families within 24 hours if a resident or staff member tests positive for COVID-19. A list of facilities that have had a resident or staff member test positive will be posted on the Ohio Department of Health's website. We believe they're set to do that this afternoon. We know that these congregate living conditions, places where people live in close proximity, are particularly at risk and share common spaces. And these are realities that we have in the way that we interact as people. And so these conditions make us particularly at risk in those circumstances. And often we know folks living in congregate settings like long-term care facilities and skilled nursing facilities are people that have underlying health problems. They are elderly, they may have multiple chronic conditions. Some of them may also be at a very important critical end of life time. And so we need to understand they may be particularly susceptible in those environments, and that there are people in there every day caring for these individuals. We know that it's given the risks there, we had to plan for not if, but when these cases would occur because of how widespread COVID-19 is. And so we know these facilities are doing an excellent job. They're doing the best that they can do under very challenging circumstances. Most of these facilities are out there, and it's been heroic to watch the staff members and the workers come in every day and respond. Come in every day to do their best and bring their best to support the people that they care for. For these folks, it's more than just a job, it's a calling. And so I have a lot of respect for the people that have been going in and day out to care for individuals at risk. And many of them have been providing quality services for decades. They're doctors, they're nurses, they're support staff, a range of caretakers that must go into those facilities every day. And with a pandemic at hand, we know, and concerns about asymptomatic transmission, people may have it and not know it. Right now it's a particular concern that we try to be safe, but recognize that we don't want these businesses, long-term care facilities and nursing homes, to be stigmatized. Dr. Acton talked yesterday about the fact that there was a long-term care facility in Dayton where because of fear associated with the facility, they did not want to drop food off. They didn't want to bring pallets of food in to assist the nursing home. Well, we need to think about what are our basic human responsibilities to each other and try to understand the science and understand that dropping off pallets is not proposing a risk to the individual dropping off pallets. That we want to make sure that the supplies for the workers and for all the residents of those facilities are available for them. And again, some of them are at end-of-life points. And I think that we have to allow people the dignity and respect that they deserve at that point in their lives. So please, as this information becomes available from the governor, we ask that you, as a community, that we respect the fact that these agencies are working as hard as they can to try and assist the residents, and they're showing up every day to do so. And we're going to continue to support them as we have from the beginning, and know that there's a whole range of community supports that are there to assist them as well. So those are my main messages right now, and I'm going to turn things over to Dr. Gullett. Before I do, I wanted to say thank you again to Heather, who looks very nice today, and would thank her for her time here to support us as she does for these briefings. Thank you, Heather.
Good morning. Thank you again to all of our media partners here and back in your studios and reporting from home. We really appreciate your continued work to tell the story of how COVID is affecting our community. I'd like to also start today by recognizing all of the members of our community who have been donating to either social service agencies or community-based organizations, the organizations providing for all of the needs that we see increasing among our community, so food and behavioral health support, primary care support, lots of different needs that we know are increasing for so many in our community. So thank you for donating money, donating your time, donating your physical resources, what you have. That also includes the personal protective equipment. We've made several pleas in these conferences and out through messaging to donate personal protective equipment that you may have at home and or in your business, and that has been met with a really great response. And so we just want to acknowledge all of the people who recognize that this is needed on the clinical front lines in our hospitals, among our first responders, among our long-term care facilities. All of those organizations have bought their own personal protective equipment, but their orders are being canceled, and we need the donations we have until what we call our supply chain, or the flow of resources, comes back to the community. So thank you so much. We also know employers have asked for donations of sick time from other employees, as well as donations to support others in the organization, and we thank you for answering the call for those donations as well. This is a time where we have the opportunity to see all the best in what we can do for each other. We can all be at our best in the midst of a crisis, and we see that. It gets reported to us, and so we want to acknowledge and honor everybody who's being so generous during this time. Gratitude is really going to be one of the key things that gets us all through this time. Our case numbers for today, again, I'm going to say the same thing I've said every press conference. These numbers are real people. These numbers are invaluable, important members of our community. Every person in this community is an important member of our community, and so please continue to remember each of the people represented in these numbers and try to support them and their families while respecting their privacy as much as you can. The total cases for the Cuyahoga County Board of Health jurisdiction are 845 lab-confirmed cases. The age range from those cases remains 1 week of age to 101 years of age. The date of illness onset is February 29th to April 8th. And what that represents is that we have continued transmission in the community. We have continued spread of the virus. When people are having symptoms developing within the past week, we know more new transmission is happening, which is really important to understand where we are in this for our community. Deaths in our community are 25, with the age range 55 to 93 years of age. And the date of deaths is March 20th to April 12th. So picking up on sharing this range of illness onset that I just mentioned, it is too early for us to let up on all of the public health measures that we have in place. This is all wearing on all of us. We are at that point where we're settling into a new normal that most of us could never have imagined. Even those of us who do simulations of pandemics, because this is the work we do, it's still impossible to fully appreciate what these efforts would look like until you live them. So we all acknowledge this is very hard for every single one of us included. But we have made tremendous progress in this community with the public health measures that most people have been abiding by. Staying home, only going out for brief periods to get food or other essential items, and when you do so, wearing cloth masks, making sure you don't have gatherings or parties. Please continue to do these things. We also recognize that the economy is a huge part of this, and it's very hard to be dealing with layoffs, furloughs, lack of income, bills. This is really hard for all of us. And there isn't probably a more powerful determinant of health or powerful indicator of the ability for people to be healthy than having a job and having a strong economy. So we do not take this lightly in public health, but it's really important that people not get too comfortable with the fact that we are making progress. Please don't let up on these things. We all want our economy and our jobs to be back as soon as possible, but if we have more transmission, it's going to be that much longer until we can get back to the way we all want our community to be. So please know that we've got to stay the course a bit longer. I wish I had specifics about how much longer, but we are determined here in public health, along with all of our public health partners in the region and in the state to push as far as we can, as quickly as we can, on identifying cases, isolating people, identifying contacts, quarantining. Those are the cornerstones of this response, and they remain that way. And that is what we need to continue to do, along with measures of staying at home, to get us through this as quickly as we can. We continue to get reports of parties and gatherings of non-household contacts that have led to cases, including within the last few days. So I share that to say, please don't do these things, because that continues to perpetuate or cause new cases that then drags this on even longer. Okay, so I know it's really hard, but you've got to please, please, please listen to us about that, because we are seeing it. It's still happening. So for all of you who are not doing those things, we thank you. And for those of you who think it's just a few members of my family, we've got to see each other, a few of my friends, none of us have it. Actually, you might, and you may pass it along. So it's really important not to do those things. I will just reiterate what Terry said. Please try to wear a cloth mask when you go outside. And again, this is not us attempting to infringe on anyone's individual rights. This is simply us trying to give you the best information we know about how to get through this as quickly as possible. And we all have an individual responsibility to do everything we can. And so this is one of them. So I thought I would share my favorite team in the whole world. I've been a lifelong Cleveland Browns fan, grew up in Northeast Ohio, and I do believe we will win a Super Bowl before I die. And so my kids and my mom made this for me. So this is one of the masks that I've been wearing as well. And we just want to continue to remind you that we are doing this too. It's a little hard for us to convey information in a press conference, but we had these on right before we walked in, and we'll have them on right as we walk out. And we have them on in the stores and other times. So thank you so much for listening to our recommendations. Finally, I'm going to revisit the issue of stigma and cluster investigations. I have for a very long time been talking about cluster investigations as a critical part of what we do here in public health, not just in COVID-19, but in all sorts of infectious disease outbreaks that we handle on a day in and day out basis that never really make the news because they're just the way things are normally. But now this is such a big deal that you're learning more about what we do in cluster investigations. So our long-term care facilities and many other organizations have worked tirelessly with us and partnered with us in a matter of talking to them multiple times every single day. They are doing everything we're asking. They are being proactive before they even have cases in making sure they know the best infection control practices. We are working with our county to ensure that they have the right personal protective equipment and that every person in the facilities knows how to appropriately use that equipment to prevent further transmission. But you've also heard me talk a lot about stigma, and you've heard me talk a lot about people having negative experiences because they have the infection or they're associated with someone who does. So I just want to continue to remind everyone, and picking up on the words of my colleague, Dr. Acton, please know that we are working with these facilities, but we cannot cause stigma. We cannot single individual facilities out because this is everywhere. This is in multiple employers' organizations. This is in multiple long-term care facilities. This is in multiple other types of organizations. And it's not a failure of leadership in any of those organizations or a failure of everyone wanting to do the right thing. This is a reflection of the degree to which our community has been impacted by coronavirus or COVID-19. So I would ask you to recognize how hard these folks are working. They've given us access. We're physically either on the phone or actually in their facilities, our team, on a regular basis. And so I just want people to know the degree or the detail with which we are working with them on the inside to prevent future transmission. This is really hard for them, and it's really hard for us, but we're in it together, and we're partners in this. And so I would hope that that's important context for you all to know as we go forward. This is not, the list you see today is not going to be the list that you see going forward, because this infection continues to rise everywhere, which is all the more reason it's so important for every single one of us to do everything we can to stop the infection and to stop us from being the ones who transmit it to others. So with that, I will stop and give time for questions, and Terry is also available for questions. Thank you so much.
I was hoping to ask a little bit about contact tracing. Now, this is something you guys have been doing for a while now. I'm sure the workload is crazy. How are you holding up? Is there plans to get more staff in? We're talking about this discussion on a national and state level. What are you guys doing here to get more folks to help with that monumental effort?
So Courtney's question is about contact tracing. It is, how are we doing and how do we have enough staff given the volume? And what are we doing to ensure this is something we can do long term? So I really thank you for that question. I would love to stand up here every press conference and give you the details, the very sort of nerdy public health details of what we do, because we don't get a chance to talk very much about what we do in public health normally. But this is so important. And so contact tracing, and maybe you saw Dr. Frieden, former CDC director, put some stuff out this weekend, which was sort of highlighting 4 of our big pieces that we're using here. And it was really great to see someone at that level saying, this is what our local health departments need to be doing, which is what we've been doing. So I'm happy to talk to you about those details. So when someone is identified as a case, we then, as you know, we've been talking about, identify all of their personal contacts, work contacts, everybody who's been around them within 6 feet for a specific, a reasonable period of time, up to 48 hours before the symptoms came on. And then we make a list of those, and and people have been very gracious in sharing information with us so we can do our jobs. They give us the name. Sometimes they'll tell us the relationship with that person so we understand the context. And then they give us their phone number or several. And then we have people call them. And then we find out if they're sick. Or we give them information about how to protect themselves and what quarantine means. So quarantine is for people not sick but who've been exposed. Isolation is for people who are sick. And they're a little bit different. Isolation requires really walling yourself off. Quarantine is staying home, but you're not sick yet, so it's sort of being more vigilant within your own home. So we do those one by one, and as you've identified, it takes hours to do this. So we have an incredible army of public health professionals here, a huge staff that have been mostly redeployed to COVID-19, although we have a lot of other essential public health functions we're still maintaining, like food service inspections and other things. So that staff has been working really hard 7 days a week to do the contact tracing. We also have a very long-standing partnership with the Case Western Reserve University School of Medicine. I was placed here in 2013 by our dean to build partnerships between our School of Medicine and the health department, and part of that was that one of our strategic priorities is improving the health of the community, and there's no better way to do that than be in true partnership with your health department. So that set the stage over the last 8 years for being able to ramp up having medical students who right now are not in their clinical work actually work here with us and do case calls, interviews, and contact tracing. So between our own amazing staff, which is the large staff, and our relationship with the School of Medicine and our medical students, we actually have an army that has stayed ahead of the numbers. We are able to call our cases usually within 24 hours, and we're usually able to call our contacts within the first few days that we find out. So that has allowed us to stay ahead, but as cases grow, the volume grows. So we're continually reevaluating whether we need more support, but right now that's sort of how we've kept ahead. And as you know, the quarantine numbers and the isolation numbers I gave you last Friday are in the thousands. But we have been able to contact those folks individually. So.
And it might be obvious, but I'd like you to kind of expand on it a little bit, but why are the long care facilities so vulnerable, and why is it so dangerous for them to get a cluster?
So the question is, why are long-term care facilities so vulnerable, and why is it so dangerous for them to develop a cluster? So a cluster just means 2 or more cases in one location or associated with one location. And in long-term care facilities and other what we call congregate living, so living multiple people, more than just a household, multiple people in a large dwelling, the reason is that you're living in close quarters, right? Even if you have your own room, you're still in a building where there are a lot of people. And those tend to be, in those facilities, people who are highly vulnerable or at risk for complications from COVID-19, because we know this virus can affect everyone, but we also know if you have underlying medical problems and you're already sick, that this is that much more difficult for you. So it's really a combination of having a number of very at-risk people who are medically fragile, also in a place where you have a lot of people in and out, and you have fairly close living. Those are kind of the main reasons, and that's why we're so vigilant about our initial call, our initial visit with all these facilities. We go through all of the details about where transmission can occur. And that's why we also sometimes have our sanitarians or our inspectors come with us, a doc or two and a sanitarian, to identify infection control and how we can best get ahead of it. And our facility partners have been really good about that. But those are some of the keys about why people are more at risk.
And will this heightened reporting, mandatory reporting, does that affect the outcomes at all? Is that going to have a positive effect, or is it just more for the families to be better prepared? Or I guess is there a health benefit to what the governor mandated?
So the question is there a health benefit to the governor publicly reporting the names of these facilities? I would say that we already know that facilities have been talking to their families, their residents, their families, and their employees already. That's part of the initial work we do with them. And in many cases, they had done that even before they called us, before they had a first case. A lot of these folks have been doing that. So I don't think it's going to change their messaging because they've already been communicating with their own stakeholders. But I do think the governor has indicated it's about transparency with the public who might be seeking to enter a facility. But really, this is about health. This is about us minimizing transmission. So it doesn't change anything that we're doing. We're already working very closely with these leadership at these facilities. So it doesn't really change anything on the public health side, and probably doesn't change what they're doing because they've already been very closely focused on messaging for each of those groups.
Statewide, the numbers have been essentially flat for new cases over the last 6 days. Cuyahoga County has gone from, 50 new cases a day to now 99 since Friday. So obviously kind of on the downside of that. Do you worry people will get complacent when they see these numbers?
The question is, it looks like statewide and also within the county that numbers maybe aren't as many new cases per day, and am I concerned that people will become complacent? Indeed I am, and that's why my messaging today is that we cannot let off. We have made a lot of progress, we really have, and we thank you all so much for making the sacrifices you have to stay home. Those of you who are furloughed from work, we know that's not easy, and so thank you for doing those things. But we also know that this is not a time where you can say, well, it must be lower, I can go out and do a little more today, or not wear my Cleveland Browns mask or what have you, right? We can't do that. And I wouldn't necessarily say that we aren't going to see other days where we have more than 50 cases. You know, I think we have a lot of testing here compared to other parts of the state. The testing is still limited. So if we get more testing, you will see more cases. And so that's one thing to remember. It doesn't mean that we don't have a high degree of spread right now. We do. We're still seeing new cases. So all those new cases have the potential to infect many, many, many other people. And if they don't isolate, it will be that many more people. So please don't stop. Please don't take this as we can pull back now. We will let you know when it's safe to do so in conjunction with our state leadership. But in this community, there is still a high degree of spread, and you'll continue to see that over the weeks to come with new cases.
Do you believe there's as much COVID-19 in the community as maybe there was 2 weeks ago, and it's just less testing?
The question is, do I believe there's as much COVID-19 in the community as there was 2 weeks ago, and is this just a reflection of testing? We will not know by actual numbers, but I will tell you that we still have a large number of people who are reporting symptoms who cannot get tested. So again, I'm reporting to you lab confirmed cases, but we still have quite a few people in the community who are reporting symptoms, and they're appropriately staying at home. They're not sick enough to be in the hospital. So we also know that there is a lot of infection still happening. I can't really tell you with any certainty whether that equals what was 2 weeks ago, but I can tell you there's still a lot of infection here.
It's something I wanted to add around, if I can, is back to the contact tracing piece. So in 2013, I had the honor, in the 7 years previous, I was on the board of the National Association of City and County Health Officials, NACHO, and had the honor of serving as the president in 2013. And so at that time, the message was, and continues to be, nationally, the need to invest in public health. Dr. Frieden, the former CDC director, would say that public health is the best, prevention is the best buy. 3 cents on the dollar goes into public health prevention. So we need to think about our healthcare dollar and how to get the most out of it. So when we talk about contact tracing, Courtney had brought up this issue around contact tracing. We know if there's concerns about measles cases in the community, we have to identify those that are in close contact and begin to use the same strategies around isolation and quarantine. We know that if we have an outbreak of norovirus, which is spread by fecal-oral transmission, that we need to identify close contacts, and we need to identify sources. So this shoe leather public health work is part of what we've always done as public health practitioners. And so we need to know at the national level that we've seen a 30% drop in staffing for health departments across this country at the local level, a 30% drop. And so in reports from Johns Hopkins, which came out recently in this discussion around contact tracing and needing to ramp up, that is decidedly a large investment in infrastructure at state and local health departments to support the horsepower that you need to deliver that service of prevention. And we know that if you do that up front, you save lots of money on the back end. You pay now or you pay a hell of a lot more later to deal with the response and the outfall from infectious diseases. So the reports and the identification of contact tracing as the way to identify people at risk and people who are at sick and get them off the street and at home monitoring their symptoms is a good buy in prevention. It means they're not flooding the emergency rooms. It means they're not filling the ICUs. It means that our EMS are not being inundated with reports for transport. So the message here is prevention. And the message is, as the reports come out and we begin as America to digest the impact of this and what it means for us going forward, it means we need to invest in public health so that we have the infrastructure to respond. All of us in real time are ramping up and doing the best that we can, retasking people and training people who have done case investigations on foodborne outbreaks, getting them now trained up to get involved in response around COVID-19, and we're doing that. But that infrastructure across the country needs to match the need and what I think Americans expect from a public health department. So I wanted to add that piece of information from my past experience. Any questions? Okay, well, we appreciate your time. Go get your cloth mask when you're in public, and you have a great rest of the week.
Will Dr. Gullet be marketing those masks at some point after the pandemic?
I think if she markets her Browns mask, she may have a problem with that, but you could talk with her about it.
This is officially licensed fabric, I just want to make that clear.
There you have it. Thank you very much.